On an average day, dozens of patients walk through these gates, mothers in labor, children battling malaria, needing urgent care. For many in this community, this is the nearest fully functional hospital. Hope Missionary Hospital ranked second performing facility in the region in 2025. In areas where government health centers face drug stockouts, staffing gaps, or long queues, this facility absorbs part of that patient load.
In this community, they need more help in that area concerning the antenatals and the delivery. Most of our mothers are still delivering from home, and it is usually related to the financial situations. That even the fact that we offer our services at the minimum costs possible, they can still find challenges to make it to the hospitals. And in such cases, they are exposed to so many risks in maternity, PPH, they bleed, and sometimes we receive them in severe cases when they are almost to the end of their life.
On average, I can give a 240 patients because there are times I go in 300 patients, there are times I be in 230, like that. So I would give 240, 250 on average every month.
But the hospital's work doesn't stop at its gates. Through medical camps and community outreaches, health workers conduct HIV testing and counseling, malaria screening, cervical cancer screening, and health education. These services target communities where access to structured healthcare remains limited.
Time I had some problems, I do call them, and they come immediately. They help. They come up to home, because I remember I called the Dr. Clever from the hospital because I wasn't feeling all that well. When I called him, he told me it is fine, you just be there, I'll make sure I'll come with you, with Peter.
Over the last 10 years now, we have been doing work in over 10 districts in Uganda, where we send out medical teams to do medical camps. And when we do these community outreach clinics, we are improving access to healthcare, but then we are also improving healthcare coverage in these areas because many areas are unreached.
They have complemented to the district health service because they have a bigger catchment population that they are serving. So you may realize that cases which were supposed to move beyond this, they are closer. They reduce on that distance because as government we say at least if we could have our facilities within 1 kilometer or 5 kilometers. I believe having Hope Missionary here fulfills the community around here. And as I've said, is offering almost the entire package. So it is also reducing on the congestion to other facilities. More so another hospital like Toro General Hospital, which is our public facility around.
Just last year alone, we had 438 mothers receive antenatal care through our hospitals. And we had about 90 babies delivered, and we had 350 mothers directly being handled by our healthcare professionals within the hospitals.
Private, not-for-profit facilities account for a significant share of healthcare delivery in Uganda, particularly in rural and peri-urban settings. They operate under Ministry of Health guidelines, submit data into the National Health Information System, and receive limited primary healthcare support grants from government.
We are grossly understaffed human resource for health. As a district, we are operating at a percentage of 31. As per the new structure, that is very little. And then when I look at the old structure, we're just at 67. And yet, as per the guideline, at least we should be at 85. So that is a big challenge. And if you don't have adequate human resource, it compromises the quality of service. It means there is long waiting hours for patients, for clients. And yet that's what they tend to hate.
But much of their funding still relies on faith-based networks donors, and modest patient fees.
But if we can collaborate with the local health systems, with the local government, it means we can have key personnel like obstetricians employed at our facilities to serve the community at large. The other areas we can partner in is also in in refining of data collection and dissemination tools, because government is keen on ensuring that data is collected neatly and that this data is actually digitized.
We are phasing out paper-based, these registers. We are going digital. But as a district, they have just rolled out to the general hospital. Only Health Center 4s are pending, Health Center 3s are pending. And yet now it is not easy to access registers. So that is going to compromise on our data. So if we can have a partner that can support and we facilitate that, we would appreciate.
Like many PNFP facilities, Hope Missionary Hospital faces its own constraints: rising operational costs, medical supplies, and human resource demands. Yet, administrators say their mission remains clear: accessible, affordable care for vulnerable populations.
The other areas of collaboration would also be in emergency services. We have an ambulance that is available, and right now, not all government health centers have access to ambulance services. But our ambulances have been made available to support health center 3s in the community. And for us, this is an ongoing partnership that could actually improve. Actually, as I speak right now, we are in the process of importing a new ambulance from the United States, which will, when it's here, it will be a mobile ICU. It has mobile intensive care capabilities.
Facilities like Hope Missionary Hospital illustrate how faith-based institutions are not competing with public health services, but complementing them. In communities where every minute counts, that collaboration can mean the difference between life and... What remains clear is the role faith-based institutions play in complementing public health services. In communities where every minute counts, that collaboration can mean the difference between life and loss. Walter Mwesije, NTV.